Hello, I'm Dr. Dennis McKenna, as always joined by Dr. Fred Venditti, our hospital system general director. Today is Thursday, November 19th, giving you the update from Albany Med. Let's pop up the first graph. These are the 8 counties of the capital region, 137 currently admitted to the hospital with COVID-19. Fred, there's been talk of this in the newspaper lately. It's actually been a pretty big news story lately that they're seeing the number of hospitalizations go up.
Yeah, Dennis, it's happening here, and obviously it's happening nationally. We're at almost 80,000 people hospitalized nationally with COVID.
Let's take a look inside the medical center here. This graph shows admissions and discharges. This is about the last 3 months. You can see yesterday there was 3 that came in and 3 that were discharged.
Yes.
So the number currently in the house is we have 40. We have 28 on the floor. We have 12 in the ICU and 2 on the ventilator. So 2 out of 40 is still a smaller ratio on the ventilator. Our teams are still working very hard caring for all 40.
And Dennis, the time on the ventilators has come down as well.
That's great. I think some of that might have to do with the advances in our therapeutics and the techniques we're using to treat these people.
Everybody's getting remdesivir, dexamethasone, and convalescent plasma, and I think that probably is making a difference.
Absolutely. Incredible. It should be pointed out, Fred, that the number of people that we have in the hospital today with influenza is 0.
That's right.
Continues to be 0. So we're watching that number very carefully. If we see the number go up, we'll put it on the graph, but in point of fact, there's none in the house.
That's good. That's all good news.
Absolutely. We had incident command today. Actually, we're calling it COVID operations.
That's right, Dennis.
COVID operations. Fred led us through that effort today. There's a messenger which is going to come out, which is going to highlight the things that were decided in that meeting. We're not going to go through all of them, but let's highlight a couple right here. There was a talk about high-risk exposures, travel, and testing. Basically, there are 3 different categories you can fall into as far as whether or not you might need some testing. You could be exposed to a patient or COVID in the hospital. You could be exposed in the community, or you could be someone who traveled to a state outside of the contiguous states. Fred, break that down for us as far as the testing requirements.
So Dennis, if you have a high-risk exposure here in the hospital, or you've traveled to a state with high rates of COVID, we're going to do serial testing for the incubation period to track you.
Okay.
If you have,
that means about every 3 days.
Every 3 days. So when you get back, or when we find out about your exposure, and then every 3 days after that. If you have an exposure related to a household member, so your wife, your son, someone that you live with, and you're on quarantine from the county, we're not going to let you work for the quarantine period.
Okay. Fred, you used the term high-risk exposure. That would be somebody who was exposed to somebody who had COVID when the individual was not wearing full PPE.
Or the correct PPE.
Or the correct PPE, including eye protection.
Absolutely, Dennis.
Let's talk about that a little bit more. We mentioned the other day that we had 55,000 face shields available to our workforce, which is a form of protection for the mucous membranes of the eyes,
that's right,
as would be goggles. Why do we have 55,000? Why do we have so many?
Well, Dennis, we're required by the state to have a 90-day supply of PPE. So masks, gowns, goggles, or face shields all fall into that category. So we have at least a 90-day supply, and in some cases more.
Another form of PPE that we've talked about are the N95 masks. And in the past, we've talked about how we reprocess those. Is that something that we're still doing?
Yes, Dennis, we are. We're thinking about the future, and I don't mean the distant future. I'm talking about the next few weeks or months.
Right.
So we are reprocessing N95s, as are 90% of hospitals in New York State, following the CDC guidelines for reprocessing, so either aerosolized hydrogen peroxide or UV light, and with the full knowledge of the Department of Health, knowing that we and all these other hospitals are doing this. Very safe.
And if I'm wearing a mask and it gets reprocessed, I get that mask back.
Correct.
Okay, so
it's a one-to-one.
Excellent. All right. Absolutely safe practices across the board. Last question about PPE or masking. We mentioned in our video the other day that patients are now also, when able to, wearing masks. Are they expected to bring their own mask in, or are we giving them a mask?
No, Dennis, we're giving them masks, and we're being practical about this. So as you said, when they're able to wear masks,
right.
When they're in a double room, we're asking both roommates to wear a mask. When a patient's in a single room, we're asking them to put a mask on when people come in.
Excellent.
Their providers, their nurses.
All right, very good. Thank you, Fred, for those updates on COVID, and
welcome.
we'll certainly talk more about that next week. Let's change gears and talk about our search for our Chief Nursing Officer. Very important hire for the medical center. What's the update there?
So Dennis, we've been going through a process for the last couple of months, and we've come down to sort of a finalist that we think is going to be a very good match for us. So next week, we're trying to set up a series of video meetings with probably somewhere in the range of 60 of our bedside nurses to interact with this candidate, to give us some feedback on their views of the candidate. We want to be inclusive. We want to know what our nurses think about this candidate. And we'll see how that goes, and then perhaps we will have more information, more news to report.
And my understanding is it's going to be a significant number of nurses who you're going to ask to be part of that process.
Yep, we're going to try to set up 6 to 8 sessions with up to 10 nurses in those sessions. So everybody gets a chance to ask a question and interact. We would ordinarily have done this face-to-face,
Right.
but with COVID, we're going to do it by video.
All right, very good. Let's end on what I think is just some great news, a series of great news. There is something called the Public Relations Society for America, and we are part of the Capital Region chapter. And that looks at all the different ways in which public relations are done. Hospitals, businesses, centers of learning, education. There's obviously anybody, and everybody does
large group of
public relations.
People. Yep.
And they had a virtual awards meeting last night, and we have somebody here at Albany Medical Center who was named the Marketing and Communications Practitioner of the Year. I think his picture's up there right now. Who is that individual?
Geez, you know, that's Matt Markham.
Yes.
Congratulations, Matt.
So Matt's in the room with us.
Outstanding.
Matt's in the room with us from the very beginning. He's been involved on this journey with us, helping craft our message to the community, internally, externally. Nobody more deserving. We're so proud of Matt, and we congratulate him on winning this really incredible award.
Done a tremendous job.
Yeah, absolutely. Now, in addition to that, we also received another award, which is the Public Relations Response, and this was related to COVID.
That's right.
And let me name off some of the things that we did, Fred. Videos, press conferences, media relations, intranet, extranet, all different ways in which we communicated. The team did it all.
They did a tremendous job and won, a fantastic award, fantastic recognition for that hard work.
And as we were talking about before, not only is it a recognition of the team here, but it really speaks to the role that the medical center plays in the region. This was obviously a time where people were clamoring for content, factual information delivered in a way that was hopefully reassuring and calm. They looked to the medical center to deliver that message, and Matt and his team helped craft that, which is remarkable.
Yes.
And there was one other award which we won, which was the Safe For You TV commercial. I think it was a 30-second ad, and it was released. And it was a way of reminding people in the community the message we're still trying to deliver today.
That's right. And that was a video award from this society.
And that message is, we can care for COVID patients, but we can also care for everybody else.
And it's really important that you don't neglect those other issues you might have. Seek the care you need.
Still as important today as it was back in April.
Very much so.
All right, very good. All right, well, we're proud of our team, and we'd like to congratulate all of them. That's it. We're heading into the weekend.
That's
so
right.
We'll be back again on Tuesday. Now, next Thursday is Thanksgiving, so maybe,
That's right.
Maybe
well,
we'll do it
see.
anyway.
We'll see where we find ourselves.
All right, very good. We ask that you please have a safe weekend. We'll see you next week, and we ask that you once again take care of yourself, take care of each other, and we'll see you on Tuesday.